Good evening to all. Prakash sir, good evening.
Very good evening, sir. Good evening, everyone.
Yeah, well, that's the next best thing at this stage. If you can't get denied the access to as many balls in this final 25 of the innings, you know the damage that he can do. Plays 360 right around the ground.
Did I hear me that?
IAP. Hi. Good
Good
evening.
evening, sir. Good evening, sir.
Good evening, sir.
Good evening, everyone.
Good evening, sir.
ಈ ಕಡೆ ಬೇಡ ನಾನ್ ಕಾಣಿಸೋದ್ ಬೇಡ.
ನೀ ಯಾಕೆ ಅನ್ಸೋದು?
Good evening, all.
Good evening, all.
Good evening, everyone.
Good evening, sir.
Good evening,
Dr.
everyone.
Samir. Good evening. Jnanamurthy, sir. Good evening.
Namaskar.
Namaskar.
Jnanamurthy, namaskara.
Oh, Datta Sahab. Ashok Chakravarti of
Hey,
Karnataka. So nice to see you, sir.
Thank you.
Are you very much in India or in abroad?
I am in Bangalore.
Bangalore? Howda?
ಹೌದು.
Oh, I see. Which part of Bangalore?
I'm in near Chikkabidurgallu.
Chikkabidiragallu.
Just a Jindal city. IKEA.
Oh, okay. So other end of Bangalore. You are in northern side of Bangalore. I'm in southern side of Bangalore.
Right.
Poles apart.
So I'm spending my summer vacation here.
Oh, excellent.
Good evening, Dr. Rashmin.
Good evening, Datar sir. Good evening, Jnanamurthy sir.
Good evening, sir.
ಚೆನ್ನಾಗಿದ್ದೀರಾ ಸರ್?
ಏನ್ ಒಣಗಿ ಹೆಂಗಿದ್ದೀರಿ? ಆರಾಮಿದ್ದೀರಾ?
ಸರ್, all your blessings. Thank you. ಚೆನ್ನಾಗಿದ್ದೀರಿ ಸರ್?
ಹ್ಞೂನ್ರಿ.
ಜ್ಞಾನಮೂರ್ತಿ ಸರ್, ಗುಡ್ ಈವ್ನಿಂಗ್, ನಮಸ್ತೆ.
ಗುಡ್ ಈವ್ನಿಂಗ್. ಸಾರಿ, ಆಚೆ ಕೇಳ್ತಾ ಇದ್ದೆ. ಚೆನ್ನಾಗಿದ್ದೀರಾ ಮನ್ಕಿ?
ಸರ್, ಚೆನ್ನಾಗಿದ್ದೀನಿ ಸರ್. ಆಲ್ ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ನೀವು ಹೇಗಿದ್ದೀರಾ ಸರ್?
ಫಸ್ಟ್ ಕ್ಲಾಸ್, ರಿಲ್ಯಾಕ್ಸ್, ಸೆಮಿ ರಿಟೈರ್ಡ್.
Dr. Samir. We'll wait for our president, Dr. Vasant Kalatkar.
Yes, Dr. Neelam Mohan has joined, and Dr. Vasant Kalatkar is joining. Dr. Yogesh is also joining, and Dr. Basavaraj is also joining.
We welcome Dr. Neelam Mohan, sir, President-elect, Madam.
Thank you.
Very happy and glad you took the time out to join our CMIC one of its kind workshop. Thank you, madam.
Yes, you people are doing good work. Everybody should be there.
Thank you, ma'am. Your blessings, your good wishes, we badly need and support.
Thank you. So today's topic is what? It is the first day or what is the session today?
This is the inauguration and open for all the members of Indian Academy of Pediatrics, free. And it is an introduction of the workshop on artificial intelligence for pediatricians. And we will introduce the faculty and
No, but
take
we
the
were planning to do that in the Medicons. So you don't want to wait till then and then take it forward?
This is the batch 1 beta version. We are just floating a batch and making a small program and then testing the waters. You can say it is only for 1 month and it is 10,
I see.
11 intense hours every day, every weekend only for Saturday and Sunday. And Pedicon, definitely we will have a bigger scale like we had last time in Hyderabad on a different topics. We will definitely have artificial intelligence then and there. There is a lot of demand from our members and it is now we had to close down. There are 20
So
members in
who's the
waiting list.
chair and secretary presently?
Chairman, myself, Dr. Rashmin is the secretary and past president chairperson is Dr. Samir Shah.
Good evening.
Dr.
Yeah,
Samir
that I
Shah,
knew.
Rashmin is there. He is our secretary.
Rashmin,
Deepak
yeah.
Chiradoni is our Deepak Chiradoni is our treasurer from Karnataka. And
where is the
Dr.
Rashmin from?
Rashmin is from Anand, Gujarat.
Anand, Gujarat.
Okay, fair.
He is professor pediatrics there.
Hi,
And
Rashmin.
Hello, good evening, ma'am.
Very good evening.
Met in
he is an
Apurva.
active member. Last year he was a treasurer, madam.
Very nice, very nice. Bless you.
Yes, ma'am. Thank you
And,
for your blessings and welcome.
I'm
Praise
always
the-
there for good academic work.
Thank you, ma'am. Thank you. Thank
But
you.
there's so much on my head right now, you all can't
We
imagine.
know it, ma'am.
Because no, it's not what you all are seeing is just a 35%, 40. I'm doing a lot of global work right now.
Tip of iceberg.
So I've been asked now to write in 8 weeks a global paper on hepatitis. Imagine.
Madam, you have got expertise and you are
8 weeks we have
veteran.
to publish it.
Amol, welcome.
Global
Amol.
paper. And it's like, so you can imagine the number of hours I'll have to put in that also.
Dr. Samir.
Please take forward.
Hello, ma'am. Good evening, ma'am.
Very good
Dr.
evening,
Sanjeev,
Hero. How are you?
welcome.
Just I am sorting out that.
हाँ है ऐसा इसको ऊपर केस
Good evening, ma'am.
Ajay sir, namaste sir.
Namaste.
नमस्ते पवन अमोल मैंने आपको पहले ही कहा वेलकम नमस्ते
Actually, Neelam ma'am was talking now, so I thought afterwards.
Amol is another busiest.
Charges the atmosphere.
Amol is one of the busiest IAPN these days.
करना है बस.
He is working with both hands and legs.
Yeah.
One leg here, one leg there, one hand there, one hand.
Ajay, good evening.
Good
Neelam,
evening, Sanjay.
Good evening.
Dr.
Sanjay,
Sanjay
sir.
Srirampur, good evening.
Good evening, Ajay.
Sanjay sir, good evening.
Amol.
Kunal, good evening.
Good evening.
Good evening,
Suresh sir, good
Pallab.
evening.
Good evening, sir.
We have faculty also joined us. Dr. Prakash Tiwary, sir, is the chief faculty. Welcome, sir. For the
Hi everyone, good evening.
Welcome, sir.
Yeah, we are just waiting for our
if
president,
we
Dr.
can have
Vasant
the
Kalatkar.
program in the meantime so that we can read and appreciate and applaud the people because
I just want
I'm not
Samir to
if
start.
you can give some introduction to us also.
Dr. Samir, can you come in?
Sir, good evening, sir.
Vasant sir has come. Baswaraj sir has come. Welcome, sir. Baswaraj sir.
Baswaraj, I'm becoming more punctual. I don't even come 2 minutes late.
Ask Amol about Dr. Vasant sir.
Normally is just 25 minutes.
उनको बुलाना है क्या? वसंत सर को बुलाना है?
हाँ, Dr.
Dr.
Amol, please
Vasant,
coordinate.
He is just
Dr. Vasant sir has
20 minutes
problem of the
late.
joining. I am just asking him to join. Yeah, he is joining. I am just sending the link again to him.
Samir, Dr. Samir, kindly give
Samir,
him
why are you sitting
intro.
in Goa?
Hello, are you able to hear?
Which?
So Dr. Vasant has some problem of joining. I am just sending the link to him. In just a 2 minutes, he is joining. Just a minute. We will start in between.
Dr. Baswaraj sir, welcome, sir.
Yes, sir.
Good evening, sir. Good evening, sir.
Hello.
Good evening, sir. I'm
Good evening and welcome, Dr. Baswaraj.
Good evening, sir.
Dr. Yogesh sir has joined, so good evening to him also.
Yes, great.
And
Hello.
See him.
Hello, are you able to hear me, sir?
Yes,
Yeah.
Dr. Deepak.
Yes.
Sir, good evening, sir.
Good evening. Welcome on the board.
Deepak, good evening.
Sir, very good evening, sir. Ashok, sir, how are you?
I'm good. Thank you.
Yes, sir. ಸ್ವಲ್ಪ ಹಾಸ್ಪಿಟಲ್ ಬಿಸಿ ಇತ್ತು. I was there in hospital.
Okay.
Good evening,
Our
Neelam madam.
president-elect, our past president and presidents have joined. Members should not give excuses of not joining on time on day one on inauguration day.
Dr. Ajay, sir, any plan about prescription module?
So that Deepak?
We will
Yes.
do that.
Good evening, madam. Good evening,
Hi
madam.
Deepak, how are you?
I'm fine, madam. How are you, madam?
So lovely to see you. And which
Thank you.
university are you sitting in front?
I'm in the. This is a Goa, madam. Goa hotel.
Acha, what hotel?
It's in Baga Beach, madam. I don't remember the name exactly. We have a group, Lovely Goa group, madam.
Mm-hmm.
Last time, Srinath Mughali and we went, so that wallpaper.
Gyanmurthy sir, welcome, sir. Gyanmurthy sir, good evening.
And this fellow is always floating in Mars.
Good evening,
Zameen pe
Amol.
aa jao.
Yes, sir. Good evening,
Zameen
sir.
pe aa jao.
Good evening, Amol sir. Vasant sir joined. Kindly note,
Yes,
Vasant
yes.
has joined.
I
Welcome,
joined
Vasant
from
sir.
my mobile. I couldn't join from this my Mac.
Yes, sir.
I don't know what is it. They are continuously asking for this sign in, sign in, sign in. क्यों समीर ऐसा क्यों हो रहा था? I don't know. चलो ठीक है. It's
This is
okay.
AI
चलो.
workshop, na? That's why.
Huh?
AI workshop. So
AI वाले nowadays security issues is going on. Everybody wants, but security and privacy is the hot topic of nowadays. EB, OB everywhere. Security and privacy.
Everybody is requesting for
I
SPG.
welcome Dr. Vasant Kalatkar, sir.
Yeah.
Hearty welcome, sir.
Thank you.
So,
Sir,
we are start.
We will start, sir.
अजय भाई आपको दिया हुआ काम जल्दी जल्दी करो.
Yes, sir. Definitely, we have already sent. मैंने
I-
आपको भेज दिया, sir. Papers भेज दिया है.
नहीं ईमेल की व्हाट्सएप.
नहीं, गुरु प्रसाद ने भेजा है आपको.
ईमेल की है.
नहीं, व्हाट्सएप में भेजा है. गुरु प्रसाद. वाया गुरु प्रसाद.
रीसेंड करने बोलो ना.
Okay, I will.
Sure.
Yeah.
सुरेश बाबू सर नमस्ते. चलो लेट्स.
Namaste, sir.
Okay.
चलो.
Good evening, all of you. Dr. Samir, I'm starting.
Yes, sir. Very good evening. We can start definitely.
Yeah. Good evening, all of you. Welcome our President, Dr. Vasant Kalatkar ji, and our President-elect, Dr. Neelam Mohan ji, and past President, Dr. Baswaraj ji, and office bearers of Indian Academy of Pediatrics, and all the office bearers of CMIC, faculty, participants, IAP members from all over India. for this Computer and Medical Informatics chapters Artificial Intelligence workshop inauguration and introduction today. I am very grateful, Dr. Vasant sir and Dr. Neelam Mohan sir and President Dr. Baswaraj sir. All of them have attended to bless us, and this is a workshop which has generated lot of interest among IAP members, CMIC members. We have got more than 80 members have enrolled in matter of few hours of opening the registration, and about 20 to 30 people are waiting in line to join, which we can't take anymore because of the various decisions which the committee has taken. And with these few words, I request Samir to take forward. Dr. Samir.
Hello and good evening to all. It's my really pride and pleasure that CMIC is able to conduct this workshop of the artificial intelligence this year also. After the very successful last year artificial intelligence workshop of the 3 session, with the help of our esteemed faculties, Mr. Prakash Tiwary and his team, this time again we having a very excellent, very knowledgeable and in the field faculties are there to with us to make this workshop very fruitful for all the participants who are enrolled for this thing. I am extremely sorry that who is not able to join this workshop because of the lack of the availability of the slots, because we have to restrict our participation up to the 80, but we had extended up to the 87. So who are missed, definitely we will start a batch 2 as and when our faculty will be agreed. Now I requesting our president Dr. Vasant Khalatkar sir to give a starting speech of blessing. Sir, you have to unmute. Sir, you have to unmute.
Good evening, all. And really, first I regret that I couldn't join initially because of that signing in problem. I think that's also private protected password. I think so. Samir and Ajay Kumar might have done. That's a good thing, but every member want nowadays privacy and everything. So, respected Dr. Neelam, who is the president, incoming president for next year, our Dr. Basavaraja, Dr. Ajoy Kumar, Dr. Samir, Dr. Deepak, and all those who are doing the best of the best job for this. And I saw that, yeah, now it become a part and parcel of the life. At least persons like me, those who are talking daily, who want to take the advantage of everything. So this is a need, and this chapter is really doing a great job about awareness, and that shows that after 80 registration, people are after that. My request to this chapter, please keep updating to us. So our website should be good, our app should work in a nice way. I think within 8 days we are going to start our app. It will be functional. So my request to this group, really, I know whenever I call you people, you are always ready at one say thank you this group, and we can think of in an innovative way how can we reach to our general members, those who are not much more in academics, but they can use through AI. They can use their updating their knowledge, or how to say. See, sometimes there is a definitely when coming on dais, there is a fear factor. How can we talk? But I think this is the best media. Through AI, you can do something good. Like I was looking up to this one very good video of Bangalore. That guy was not knowing Kannada, and that auto wala was knowing only Kannada. Then he put that in a auto wala in a different chat box that I want to bargain with this auto wala. Auto wala was asking 200 rupees. That intelligent person talked with him, and that made this auto wala deal in rupees 120. That's really great thing, great achievement. But we should not be dependent. When I went to Turkey last year, this emergency conference, the World Emergency Conference we attended, and last year there was total session on AI. Total 3 days they had given, to AI and in emergency. But ultimately, they said you are supposed to decide how much AI one should use because human brain is much better and superior than AI and everything. Or we are have our feeling, our mathematics, and definitely we are always using our brain with emotions. So one should not forget our brain. We should be productive and we should always see that. So I once again I request the chapter to help us in improving our website as well as our app. Thank you once again. Thank you all.
Thank you. Thank you very much for your very insightful, enriching message to the group and on for the artificial intelligence workshops. Dr. Samir, with your permission, will invite Dr. Neelam Mohan, madam, to say a few words, and then Dr. Baswaraj, sir, will come in. Meanwhile, all the faculties are there, sir. Faculties are all India level faculty. Some of them have done last year. Some pediatricians who are experts in AI and Indian Institute of Technology, IIT trainers are also with us. Dr. Khanna, Mr. Khanna, Prasad, and Dr. Tiwary, Mr. Shiva Kumar, Kakkad, and Samir. All of us are there here. So they will be introducing themselves in 2 minutes. And I request Dr. Neelam Mohan, madam, President-elect of Indian Academy of Pediatrics, to kindly say a few words.
Thank you, Ajoy. Respected Dr. Vasant Kalatkar, Baswaraja, Dr. Ajoy, Samir, Shah, Deepak, and the secretary who's taken over as Divyang, the secretary who's joined. I'm sorry, I've just been introduced to you all, and all the faculty and the friends from IIT. It is indeed a pleasure and honor to be with all of you all today. As you know, we are inaugurating this important workshop, which is the artificial intelligence in pediatrics. And it's been there. This kid is around the block for quite some time. It's not really the topic that we've been talking about. I think it's like the transformation that we are talking about, where we want to integrate technology into the child healthcare and ensure how we can improve. So I think it does have a potential to create a revolution. And the way I see it is in triaging, when a patient comes in the emergency, the way they triage, the way you monitor, how you can predict some pediatric illnesses. So we've all read about the automated images, and we've heard a lot of stories about the images that people have been talking about, the use that the radiologists have now been doing, and how in the cancer care and in the breast tumors and all, it really made an impact in that. And yet to see about it in our simple day-to-day life, we are going to use this to transform it. And the applications which are going to be there, how we are able to expand it. Three things that needs to be remembered, a triple E, I would say. One is the ethics when we are doing the, about the AI. And second is the equitability. There may be a bias when somebody is using and the other is not using. So the equitability of it across the, forget the globe, even in the country, how we are going to make it equitable and effective is an important thing to dwell upon. And pediatricians should think this tool uh, maybe to help them guide their applications and technology. But of course, please don't forget two things: the human touch and your communication, your emotions, your empathy. This is something which AI can't, do. And in a profession like pediatrics, they're really top of the line. So I would congratulate the organizing team once again. Ajoy, Samir, and the rest of the team, apologies. I do not know all your names because they were not shared. So apologies for that, but I would congratulate for curating this program, this workshop, and empowering the community of pediatric IAP fraternity with knowledge and foresight. So here we go. Let's start today into getting more smarter pediatric practice and wishing the program a great success. Thank you. You are muted, dear
Yeah, thank
Ajoy.
you very much, ma'am.
Thank
Wonderful message and inspirational inauguration by you. And we will definitely try to keep up with your triple E message of equitability, efficiency, and also ethics in this. I can assure you, our faculty are well versed in these areas, and they will be dealing with it. And this is a first batch, and this is a inaugurational batch. You can call it a beta batch, even though it is the second time we are doing this year. Last year we did a very successful one. Because its popularity, because its demand, we are continuing this. So I request Baswara sir to kindly say a few words.
Yeah,
Thank you,
yeah.
ma'am.
Thank you very much, Dr. Ajay Kumar, sir, Honorable Chairperson of our IAP Computer Chapter, Secretary Professor Reshmil, and Honorable
Rashmi.
Treasurer Dr. Deepak Chirdoni, and our immediate past Chairperson Dr. Samir Shah, the whole computer chapter, which has been coming out with a lot of innovation, with the gracious presence of our National President, Dr. Basant Kalatkarji, and President-elect Dr. Neelam Mohanji, Dynamic Secretary General Professor Yogesh Parikh, Dr. Atano Badra, our Treasurer, and all the Central IAP, OB and EB members. When the computer chapter started, one of the questions which has been there in the minds of the many pediatricians, what is there for a pediatrician to do it in a computer? But in the today's era, where the computer is becoming an norms and artificial intelligence and chat GPT, all those things is becoming a now and a very inevitable. One of the famous say is AI is going to replace the doctor and teachers. When I was just interacting with few months back with the NMC, how do we overcome the shortage of teachers? One of the immediate question came into the mind. It is an AI which is going to be used in a due course of time compared to the traditional thing. And it is true, it is not. It is going to replace, but as President-elect Dr. Neelam Mohanji said, human touch is not going to be replaced. That means, as a pediatrician, we need to cope up with the AI. So our computer chapter is right in starting this very innovative workshop. I'm sure all the members is going to be benefited out of with an evolution of a technology. Best wishes for the today's program. Looking forward to learn, and especially whenever we used to conduct an election in Central IAP, most of the time we used to turn towards a team Gujarat led by Yatin Mehta, Sanjeev Goyalji, and Dr. Samir Shah, Prashant Karya. All of them used to help a lot. I'm sure our computer chapter is coming out with one more things like this that will bring in a lot of creativity and innovation in the Central IAP. Best wishes. This is what the IAP is known to be in a different organization. Even though a lot of negativism is there, but a lot of positivity in the year 2025 is created by the team 2025 in all aspects. That goes to all the 50,000 members. Best wishes for the today's program. Thank you. Thank you very much.
Thank you, sir, for your wonderful message and inauguration and good wishes for our workshop and CMIC's chapters. Good work appreciation. Dr. Samir, kindly take forward from hereafter for introduction of all the faculty. We have Secretary Yogesh Parikh, sir. I
Sir, he is
request him
there.
to say.
Sir, he is there. Dr.
He's there.
Secretary.
Yogesh Parikh, sir, kindly say a few words, sir.
Yeah. Thank you, Ajay bhai, and thank you, Samir, for inviting, and thank you, Dr. Rashmin ji, also for reminding. So first of all, sorry to join little bit late. I was stuck up with the traffic. So here, in the traffic also, the AI will be the useful, and we are using in the some metro cities. So, respected seniors and dear colleagues, what is the role of AI in the healthcare or the medical professional life? Whatever the Dr. Neelam Mohan Madam and Dr. Basavaraj and Dr. Vasant Kalatkar mentioned, it will be the new era of the medicine. I think it will be now new era is open in the field of the medicine, and today we are standing between the crossroads, because I came through the traffic, so I'm mentioning that this is the crossroad between the medicine and technology, and we witnessing the revolution that is reshaping our lives with the whatever the we are diagnosis, we are having a treatment, or we are the having a patient care in the area. So AI will be the not a longer distant dream. Whatever the Dr. Basavaraj mentioning, it will be using in the now in the modern medical colleges, and transforming the whatever the learning and in the healthcare. So that is now it is possible, and we are using mostly in the diagnostic, predictive analysis, and the drug discovery, and the administrating efficiency. So few challenges are still there, whatever the human touch and ethical consideration, everything, but AI will be the now the dream, and now it will be the came true. So it is also raising the importance, whatever the ethical question, but we are there to ensure the patient privacy in the new era of the data-driven medicine. So let the whatever the medical profession must let the conversation on the responsible AI integration. So what the human touch, what are the ethical or morals and everything with our NMC or the ethical guideline, we should integrate this in our medical practice, and we must advocate for the transparency, ethical AI development and the policies. So IAP and the computer chapter are doing, and whatever the Dr. Basavaraj mentioned, Gujarat is leading ahead. So Dr. Amit Shah was there. Now the Dr. Samir Shah, Ashmin is there. Dr. Samir Sanjeev Goel and Dr. Bhavin Modi, Yatin Ji Mataji. So they all are working hard to give their heart and soul to the IAP. So now we think the what are the future collaboration like e-voting in our ballot paper. Now it is a very easy to get the result within a half an hour. Previously, it was before 10 years. I was the witness in 2015 election while I was contesting first time. It was the whole night. It started in the morning till up to 2 o'clock or 4 o'clock in the early morning next day. So this is the now the change. So this is also use of the computer and our knowledge. So let us have a future in the collaborative with the synergy between the human intelligence and the artificial intelligence. So AI will empower our doctors, medical professionals. It will not replace them, but I think it will enhance the diagnosis precision and improve efficiency and expand access quality care. So thank you very much for inviting, and thank you, Samir, for the reminding. Thank you, everyone.
Thank you, sir. Yogesh sir, for your very
Thank you,
wise.
Ajay bhai. Sorry to mention Dr. Ajay bhai.
Sir,
And Dr. Deepak Chiradoni.
sir, no
All the
problem, sir.
digital.
You have attended and given a very wise advice to
Sanjeev bhai is
AI
also here. Actually, I
CMIC
joined through
chapter.
the
Thank you.
mobile.
Thank you, sir.
Thank you. Thank you.
Thank you very much, sir. We'll keep up your word. And I request Atanu, sir, if he is here, Atanu Badra, sir, Treasurer, Central IAP.
Dr. Atnu sir has difficulty in joining, so he is not able
Okay,
to
sir.
join, but he has sent his best wishes for us. Before we go for an official starting of our workshop, I requesting our treasurer and Dr. for this say a few words regarding that Dr. Deepak Chirodani, followed by the vote of thanks by Dr. Rasmin Sesin. Keep as sweet as short as possible. Thank you, Dr. Deepak.
Good evening, everyone. Respected office bearers of Central IAP, respected office bearers of IAP CMIC, and all the faculties and all the delegates for this workshop inauguration primer, AI primer. I always thankful for joining and inaugurating this AI premium from IAP CMIC. So I am in this AI for the last 3 years. So we have a new project of AI with in association. Two IITians have come for infant cry analysis. I think our IAP CMIC will decide the SOP of that. Then we will put it in forward IAP to collaborate with IITians. There is a one AI project which is going to start. And second one is prediction of CSS, that is cytokine shock syndrome in various hemorrhagic shock fevers or hemorrhagic viral fevers in rheumatic analysis, how the prediction goes on. These are the projects which are in, and IITians are ready to collaborate with us. I think we make a SOP with them from IAP CMIC and we collaborate with IAP. I wish all the delegates to get the fruitful information from this AI workshop. And I thank all the persons who are invited and who are there in this meeting. Thank you very much.
Yes.
Yes, Rasmin bhai.
Yeah. Good evening, respected seniors. Thanks a lot at the outset to dignitaries from Central IIP, Dr. Vasant Kalatkar, Madam Neelam Mohanji, IPP, Dr. Baswaraja, Dr. Yogesh Parikh, to be present and grace the occasion. Also, my sincere thanks to Dr. Tanu Badra in absentia for his wishes. I would like to send my gratitude to all faculties, first of all, Mr. Prakash Tiwary, Dr. Satish, Prasad Rath, Professor Shiva Kakkad, Dr. Parikshit Khanna, and our own Dr. Ajoy Kumar and Dr. Samir Shah to prepare and put their efforts to this workshop for pediatricians on AI. And last but not the least, for enthusiastic support and entry to this first batch of the course, all delegates, seniors, and friends. So thank you all. And now I would request Dr. Samir Shah to take further. Thank you all.
So, my sincere thanks to each and every participant who joined today, and the office bearer of the IAP, Dr. Vasant Kalatkar sir, Dr. Neelam Mohan madam, Dr. Basavaraja, Dr.
Samir Shah,
Yogesh Parikh.
not audible.
Hello.
No, he's audible.
He's audible. He's
He's
audible.
He's audible.
Rasmin bhai audible.
And Dr. Atanu Badra, thanks for the joining. And now let's start our session with the introduction of our star faculties. And for that, I just sharing my screen. So at least you can get the idea how the faculties are well versed. And I requesting you all the faculties, please be ready with when I ask you your name for the introduce yourself. So this is a artificial intelligence workshop for the pediatricians, but it may be the mainly effectively helpful for all the medical professionals who really want to train themselves for the field. And the key features of this workshop is it's a total 11 hours intensive workshop, and it starts from the basics to the practical application for the doctors and content creation by the renowned expert in the field under the vision of the medical professionals. We will definitely providing the regular exercise and hand holding of the participants in our WhatsApp group and by email as and when required. So please remain active. And these are our star faculties, and I requesting one by one them to introduce themselves. So people should know who are there. Starting from Mr. Prakash Tiwary, sir.
Sure. Hi, everyone. Very good evening. I am Prakash Tiwary, currently based out of Noida, Delhi NCR, you can say. I am heading engineering at OPSUP. This is an American company where I am heading engineering. As you see, my area of expertise is data integrations, machine learnings, conversational AI type. Just an experience point of view, just want to extend Dr. Yogesh sir words when he was talking about 2003. So I'm just 2015. I'm just taking him to 2003 when I started the projects, and AI was just a research project. It cannot be practical. So deploying a model used to take 6 to 8 weeks of time, and getting a response, it was taking near about 10 weeks. And today I'm building a systems where response is expected to come within 2 seconds. So that is 70,000 faster. That's the experience we are carrying over the AI, and this is the scenario of AI. I am associated with CMC and IAP for last 4 years, you can say. And the last year also we have conducted a workshop. Look forward working with you, and happy to collaborate furthermore. in that area. Thank you very much.
Thank you, Mr. Prakash, sir. I requesting the Dr. Satish Prasad Rath, our today's star faculty, to introduce himself.
Dr. Samir, can I just interject? Sorry,
Yeah.
I have to guess. So can I just introduce myself if you don't mind, and if Dr. Satish doesn't mind?
Okay, not an issue.
Yeah, sorry, Dr. So hi everyone. I'm Shiva Kakkad. I'm the Vice President of AI initiatives at Jaipuria Group. So some of you would have had kids who go to State MR Jaipuria schools. So we are the company which runs that. And I'm currently leading the entire AI transformation of the group because we also have higher education institutions. I also am a faculty at XLRI, Jamshedpur, which is one of the top B schools in India. And I look forward to having a very interesting engagement with all of you because I'm also a researcher. So one of the things that I really want is to understand where exactly to put AI inside the workflow. And that in a way is my specialization. So I hope that I'll not just teach you, but learn a lot from you also. Thank you.
Thank you, Dr. Shiva. Dr. Satish Prasad, sir.
Thank you, Mr. Samir, and I must thank actually all the members of CMIC as well as IAP for giving us this. My passion has been that, apart from being a pediatrician, I'm also a scientist. Most of my work has been on artificial intelligence in healthcare. I hold around close to 20 patents. And there is a very distinct, I think, need that, doctors at this stage should be really learning what is AI because there are tremendous potentials. And always we have found this difficulty, whenever we get trained by the engineering faculties, no, let's say harm for that. But I think, medical faculties as well as medical curriculum, which is built on physiology, biochemistry, genomics, we have to train actually, we have to develop a special curriculum so that, doctors can understand it based on, the motivation as well as the biological models based on it. So my work is actually to, make AI explainable because, every medical diagnosis has to be explainable. And that would be actually our job actually in this group amongst the various other faculties who are there. I've had a research lab earlier at Philips, at Intel, at Xerox, and also was the Chief Innovation Officer for Astra DM Healthcare. And currently I had 4 companies. One of them is also a pediatrics company, as well as there is a AI consulting company, which is called Great Brain AI. Extremely excited, extremely honored to be speaking amongst the pediatricians, being a pediatrician, and I'm definitely looking forward to this session.
Thank you, sir, for your kind introduction. And now, the one of the youngest person in the team, Mr. Parikshit Khanna.
Hi, good evening, everyone. And my name is Parikshit Khanna, and I'm digital marketing. I'm AI and digital marketing trainer for last 8 years. I had the privilege of delivering session at leading institutions like IT Hyderabad, Guwahati, Roorkee, and Delhi. And also, I'm the only trainer in India who have received appreciation letter from Prasad Bharati because I've delivered the AI session for them. And also in this workshop, I'll be helping with drafting clinical notes, automating discharge summaries, improving patient communication, and even managing workflow and time better using practical tool. I'm excited to be part of this groundbreaking initiative by CMIC. And thank you, Ajoy sir, for having me and inviting. Thank you so much.
Thank you, Mr. Parikshit. And with the help of these all experts, myself and Dr. Ajoy Kumar has taken a few steps with them to make it more interactive, more doctors friendly, more doctors perspective. And with these things, we will really helping them to make it is interesting to our own participants, that is our own pediatricians and medical fraternity. So with this short introduction, we will start our scientific program. That's a program will be start on the Friday and Saturday of the May month between 9 to 10:30. This is the just introduction. That's why slightly lengthy about the introduction, but then you will get the direct flow related with the how the AI will helpful in your day-to-day life and how you can utilize them with this such a interesting topics. Starting with today's introductory session by the Dr. Satish Rath. Tomorrow we having a build the foundational knowledge of AI and machine learning by Mr. Parikshit Khanna. On the 16th May, we will having a exploring the AI application in the different field by myself and Dr. Shiva Kakkad. Exploring the AI application in different field, we will continue on the 17th May by the Dr. Satish Prasad Rath in a more detail. On 23rd, we having all the having a real interest, that is the finance and the AI, that is the really now boon for our doctors, and that will be taken care by Mr. Parikshit Khanna, and of course our finance guru Dr. Ajoy Kumar sir. 24th May, we will definitely touch what the Dr. Neelam Mohan and Dr. Vasant Khalatkar and all the other dignitaries say, that is what are the limitations, what is the ethics, and what are the bias related to the general AI, and how we can overcome and how we can bound ourselves to make it more the user and human friendly rather than dependent on AI. And lastly, we having a mega code and hands-on training on 30th May, with of course the expecting good feedback from all the participants who are joined specifically for the training of 11 hours today. Before I hand over the mic of the today's speaker, there are a few ground rules that we have to understand. All the participants who have taken as a delegate, they have to remain active in the WhatsApp group, and if not joined till now, please join it earliest. Participation in the quiz, exercise, and other activity is not to assess your capability, but it will help you to understanding the subject better. As this is workshop, the live experience and learning is our goal. We are definitely going to go for the recording for our internal assessment and quality control. So we are not assuring all the recordings will be available for all the participants and delegates who have joined. Of course, today is the open session, so everybody can get this recording of today's session, and you can check at any time. Curriculum has been already finalized after a good brainstorming by the faculties and keeping in mind the basic learning of AI for the medical professionals. So few topics may not be covered in this workshop because of its having a very intensive learning. Our aim of this workshop is to acclimatize the medical professionals with basic of the AI and its application in their day-to-day practice. We will definitely come with the advanced workshop who are really interested in detailed learning. For online session, joining with the computer will be definitely advisable. As this is a workshop and live experience, our learning is goal, and that's why please keep the your things in muted, so till it will not problematic to the other session. Please write your queries in chat box. We will try to cover all the queries during the session only, but if it remain unanswered, we will continue discussion in our WhatsApp group. Keep your audio muted and video off till the asked by the speaker or the moderator. So stay connected and let's learn together, and start with the first session by Dr. Satish Prasad Rath. Sir, stage is yours.
Thank you, Dr. Samir. I hope my slide is visible.
Yes, sir, it's visible.
So, it's great actually that, we are speaking to a group of pediatricians, and I'm really happy and honored and humbled that, I'm speaking to also my fellow, participants. As told by Dr. Samir, this would be a basic, introduction about AI, keeping physiology and biochemistry and medicinal principles, into practice. So I'm breaking this down into this way. So, what is happening now? There is a lot of talk about LLMs. And how should doctors actually be prepared about this? There is a lot of jargon that, okay, this is going to replace doctors. So my, simple as well as very clear, understanding is it's never going to replace doctors. But doctors definitely, need to prepare for this. And then we will touch upon, what are the fundamentals of LLM or generative AI, how the journey has been and where it is actually staying, and why we should be really, thinking about this. What we won't be covering actually in this session, are the details of it, which will be coming in the later part of the session, which is actually getting into a little bit more deeper. The scope of this session, we will keep it as a generic introduction as well as a motivation. And, our purpose would be to motivate you to get engaged into this topic. So this is not surprising that AI has been actually a talking point from boardrooms to the presidential chambers. This trigger cord syndrome issue which got actually published everywhere last year, where a mother actually went into 17 doctors, pediatricians, and then she was not satisfied with the diagnosis. Neither diagnosis could be confirmed. She actually accidentally asked to ChatGPT, and ChatGPT suggested this can be trigger cord syndrome later on, which was confirmed. And after this, I think, we have been getting more and more reports. Every day you'll be getting it in news that, okay, AI could solve this, AI could solve that, or AI is doing better than doctors in question answering, in radiology, in pathology. So this has become a very, very common thing. As this is also happening, many times, as doctors, we might be thinking, oh, is it happening for the rare cases or is it really happening for the common cases? So very recently, I think, 2 months back, Nature published this, where now we can actually master how TPN can be given in the neonatal unit, which is a very complex task and very, very voluminous task. But it is actually doing a phenomenal job for planning TPN actually into an ICU. So definitely it is helping. There is a lot of good things which is happening, and we should be really prepared for this. So we are living actually in a moment of transition as well as transformation, because like motors, like electricity, maybe generative AI is the next biggest thing which is happening in human history, and nowhere such fast adoption actually happened. We also know that the two of the Nobel Prizes also went, even if they went for physics as well as biology, but actually they were actually based out of AI. And not surprising that the maximum of the dollars are actually spent on AI. And we also knew came to know the DeepSeek moment, that how a new technology can actually topple the entire global economics, and NVIDIA has not yet recovered from it. So is also US, which is trying to play a catch-up game. But we know that there is a power in this great platform, and definitely I think we are looking for a very good era. To be specific for healthcare, if you consider, most of the, which are the areas where AI is going to really do a lot of transformation. Now, this is a good news as well as a bad news. Good news is this can do a lot for healthcare, because, healthcare has been very slow in adopting technology. So EMR adoptions are not very good. I don't blame the doctors for that, because EMRs are not actually developed for doctors, and that's where we have always found EMR to be a burdensome kind of a thing. But with AI's capability, this is really going to happen in a very big way. There are also overstatements that this will replace doctors or teachers. No, this is not going to happen like that way. But definitely, this is going to affect the way we are going to practice medicine. So a story is always better than speaking multiple words. So let's see actually how it is actually happening, in which way it is actually helping us. So we all have come to know that for radiology this is really making a lot of benefits. So what is actually happening in radiology is out of a complex CT scan images or MR images, we are not only able to identify which is a good area or a bad area, but also we are able to find out why this is a good area or why this is a bad area. So this is really making job actually much more easier for the, let's say, radiologists. But much more important is, you can now interact with the images. So previously, I think, if you understand the workflow, I'm working in an NICU, I see a RDS case, and then, I do a X-ray, and then I am able to see that, how much of the lungs is collapsed and how much of surfactant are be requiring. Now, imagine the situation of a resident or a situation of a busy person, and then you get an X-ray, and then you can talk to the X-ray now, with reasoning that, I'm finding this, like, this region to be this. So tell me what is the dose of surfactant I should be really looking for? Or I'm looking for the cardiomegaly, which is a little bit accentuated. So is it actually correct? So now not only we are looking at the image, but also we are interacting with the image. And this is really, really phenomenal. And why I feel this is very, very important for pediatricians, because in our workflow, you doing a case, doing an ultrasound, doing a CT, then, waiting for the radiologist report, then taking a decision is actually too late. Time is actually there where, as a pediatricians, you would be actually interacting with the radiologist report yourself, so that you can do a better job understanding the image as well as intervening it. So this is actually phenomenal. But much more even imaginative, if you will, I will allow you to go through this video. So as doctors, we have always, understood this, that, there is one part which is doing the diagnosis and the other part is actually, communicating with the parents. And then, we never have time because, we are not, enough doctors to take care of the patient education part, which is a very, very important part which is neglected. Now with AI, what we can do is, once the discharge summary is ready or the final diagnosis is ready, it can actually create an educative video. And we can supervise the video. Then once we approve the video can actually reach the parents, and then parents can actually understand that, what is happening with their babies, why this is normal, why this is abnormal. So there is complete transparency as well as explainability. This is also going to actually, revolutionize the way actually, medicine is going to be practiced. This is taking it little bit further. So there is a company I would encourage everyone to go and, look for it, which is called Path Science. And if you actually go to Path Science, what it is doing is now it is generating a simulated staining for pathology. So now, no more are the days when, if you start using Path Science or generative AI, we can just take a normal smear, we will put it to AI, and it is going to give us a simulated stained slide. Imagine the implications that, are not going to have artifacts. We are not going to depend on technicians. We are not going to have long delays of reporting of pathology, and you are going to get presented with a, already, reported pathology. So these are, kind of magics which are happening. And if we go a little bit deeper, because all of the doctors are also, we are interested into research. So there are two tools which are actually introduced, one by Stanford, which is called Storm Genie. So I can again, encourage all of you to, test it out. What Storm is actually doing is it is a fine-tuned medical AI. So you can ask it a question. It can give answer as a single professor, who is giving you an answer as an expert, and it is not going to hallucinate. All the details are going to be told to you in the later part of the classes. Whereas, it has got a very nice thing called a rounds. So, you can give it a topic, let's say give it a case history, and then, like four people are discussing the pros and the cons about it, why this diagnosis should be taken, why the differential diagnosis is not making a sense. It can really do it in, within 3 minutes or 4 minutes kind of a thing. So this is actually phenomenal, what can actually happen. Taking it a step further, when our PG students are doing dissertations or when we are actually asked to, guide a student, the very first thing is, what hypothesis you should be really working on and why you should be working on this hypothesis. I somewhere feel that, having, worked in different multinational organizations, the very difference of, our medical research and let's say the global medical research is that, our PG thesis or our dissertations are actually not on global standards. Because, we are always looking for that, is it a medical device? Is it a pharmaceutical analysis? But not on the fundamental core innovations or research. So now as a scientist, I can go and ask that, I'm a PG student or I'm an assistant professor or I'm a professor, I'm looking for this hypothesis to be tested. Suggest me some good hypothesis in Indian population, in the demography of India. And then it is going to search the articles. Then it is going to do a round robin kind of a, debate kind of a session. And finally, it is going to give you that, okay, this is the topic you should be choosing because this is the societal impact of it. This is the technical feasibility of it. And this is the way, you should be proceeding. So these are phenomenal steps as we are actually going to write papers. We are going to search the library as well as, we are going to find hypotheses in our system. Similarly, I think, what was phenomenal is, Google co-scientist was actually, given the responsibility that, can it find actually out of all the previous, records, what can be the possible drugs for AML? What can be the possible candidates? So in typical traditional drug development environment, it takes us around 10 years to 11 years, still without any certainty that, whether the drug can actually work. Whereas, this came with co-scientist output that, okay, for AML, you have got these candidates and why they are probable candidates to be considered for AML. So this is something, which is phenomenally happening. Again, I'm saying that a part is that, everything is not happening in US or Japan or Europe. We are also doing some good work in India. So this is, we have built a chatbot, based on fertility. One of my companies is actually on IVF. And in IVF, actually, the protocols, like, you consider in neonatology, the protocols of intervention, or let's say for infection monitoring, same way IVF protocols are also very complex things. they keep on evolving, as well as, doctors cannot actually go beyond this. So what we have done here is we have exposed this chatbot to the group of, let's say textbooks, which are actually gold standard, like Gardner for infertility, as well as, let's say, Dr. Kamini Rao's book, which is an Indian context. So, I'm taking that name for that part. And then when you ask a question about it, it is going to answer it only from that. But if I'm going to ask any other question, which is a hallucination thing, it is going to say that, okay, I don't know about this. So these are actually possibilities which is taking us, to multiple, let's say, opportunities. And we should be aware about it so that, we are knowing about it. Last but not the least, also there is a pediatric company called Escapes Health. I founded this company. The point I want to make here is, we go to the schools, we screen the kids about 72 parameters, and these tests are actually both visual as well as textual. So, you can get the vision parameters, you can get the videos about, ENT, you can get the videos about your, let's say, skin, you can get also your phonocardiograms, your respirograms. And then, they are processed through AI, where actually it is, suggesting the doctor that, these are the possibilities, where the doctor can look into the suggestion of AI. And then I think, it is going to say, okay, I'm confirming with this. Not only that, once you confirm the diagnosis, it is going to produce also reports which is understandable by parents. So now we write prescriptions as, okay, this patient has got allergy or pneumonia, and then these are the medicines. Whereas, there is very little space for us to communicate to the patients. Whereas, AI can generate actually patient education based on the diagnosis, so that, what patient can do actually in this. I encourage everyone again, to try out, sketch.health, and then you will see that, what are the possibilities there. So my purpose of giving all these examples are that, this is really happening, and this is really affecting, and this is affecting it in the real way. But is it all about the hype? Definitely not. When ChatGPT 4 got released, and then, the entire world got gamified, that's what we say. But is it the real potential of AI, or should we be really looking for something else? So there is always, I think, some of the elders also talked about that, we are at an inflection point and we should be really deciding, which area we should be going. It is never going to replace doctors. It is never going to have the emotion or the empathy, what doctors actually have or humans have. But it has got a lot more things. And then if we can really understand that part, we can definitely take the fullest advantage of it. Whenever a new topic starts getting, we start learning about a new topic, I think, we always, should be aware about the Dunning-Kruger of it. What it happens is whenever we get a new information, we get a illusion or a delusion that, we know about it. But we might be knowing as a consumer, might not be as an expert. Because as doctors, we are actually experts. So if really we have to understand AI, we should be really thinking that, how it is working, why it is working, how it is explainable. Then only we will be going for a slope of enlightenment. And this is actually a very important thing. So the choice is within us. Are we going to use it to write poetries, compose music, or let's say do a Ghibli image, or are we doing to do for writing papers, publishing papers, doing research, or let's say doing it for a better patient outcome? And this is very much possible. So, this is again a recent article, of last month from Nature, where this question keeps on coming that, there is a hype created that, is AI is going to replace doctors. No, it is never going to replace doctors. But definitely, I think doctors who are not trained on AI, you have a challenge that, you might be replaced by doctors who actually know how to use AI. Because it is going to make you much more accurate, much more faster, much more, let's say, legitimate. So this is definitely an area that, we should be all, taking advantage of. So with all this introduction, I wanted to give that, what is happening, what is practically happening, and then, how we can actually, understand this. So to understand this, we really need to understand it as doctors, right? How we are treated. We have a human body, which is normal, which is physiology, with abnormal, that is pathology. And then we have to identify what is caused the pathology, which is medicine. Maybe I define it in that way. So if we really go in the similar model, then if we actually expand LLM, it is called large language model. So there is something which is very large and complex. If the system is very large and complex, like human system, there is not an intricate and as complex system as human system. If we really have to understand about it and do something about it, we need to understand language of it. And the model which is actually doing the language of it and also helping us with answers for it is actually a large language model, to oversimplify it. But how is large? What is large? So again, recent finding of last year where, this project is keeping on continuing, which is called Atlas of Life. So we have identified that, human body is composed of 37 trillion cells. Now, this is really, really huge. And I'm not considering the networks and the extracellular matrix and the various, permutation combination of the possibilities, around the 37 trillion cells. So if you really have to diagnose a human condition in the real way, we really have to take, help of some assistance. And the real medicine, what we call, which is a summarized medicine and something is a real medicine. So the current biological model of medicine, I call it my donut model. We are born with a conception genome. This is the software program what with we are born, and we express, keep on expressing proteins, which are called phenomes. And these proteins get either degraded or aged, right? So when they get aged and they get degraded, they become defunct, what we call as biomarkers or a disease. So this is a scientific explanation of, life and disease. And then, when we actually stop doing it, we reach that. If we are not, because we don't know these details, so then we go for something what is called approximation, which is actually called the, let's say, lesser common, understanding of disease, or what we call as a not a precision diagnosis. Let's again, try to simplify this. So we have, Kalidas to Shankaracharya to Shakespeare to all the modern writers. But what is the tool they started with? They started with alphabets, they started with grammar, and then started with a writing style or a language. All the literary work is actually subject to knowing the alphabets, knowing the grammar, and knowing the style. So knowing the grammar or knowing the style is actually what we can call as language. So there is a language to every, form of, let's say, text or art or let's say, physics. And once you master that, then you can actually create a lot of, let's say, literature. Same way, let's say, our music is actually composed of our notes, if you call it A to E, or let's say, if you call it in the Indian style, it is Saregama. All the music, which is taking the grammar of music and the ragas of music or the styles of music, is actually creating this, infinite, ways of composing. Similar way, if you want to put it, our bodies are created actually from this only 5 alphabets, which is ACGTU. This is a combination of, this, what are the proteins which are expressed, which are the biomarkers, we are understanding or we are tasked to understand. Because we have not understood this so well, or we didn't have the tools or the visibility to understand the complex biology in such a way, so we are actually practicing something which is the reverse medicine. So this is very much needed, as also told in Begin Wherever, that the entire world is limited by the first alphabet, which is A and H. Very nicely, very scientifically explained. Same is also, what we are actually dealing with, the large language models. So again, this ego comes that, even if it is, too smart, do I really need this? Because, I have done best in my NEET. I've got a pediatric seat. I'm amongst the best of the brains in doctors also. And I'm also treating patients. So would I be really needing this? If I use this, would I be really getting dependent on this? So let's understand this. So intelligence, the word actually comes from information science. So whenever there is a lot of information, there is a lot of confusion. If the information is less, actually we are very clear about it. If the information is much more, we get actually confused about it. Imagine about that, when a patient comes to the OPD, we get the history, we ask them for, we elicit the signs, we go for some tests, we come from a diagnosis. When we are not getting this, when the, symptoms are actually too varied, too complex, too large, or we are going for a genomic test, we are going for a prenatal test, we are going for a MR scan, then suddenly we understand that, we are actually looking for, some specialty. That's where the super specialty or the subspecialties came. If a person would have taken care of, the adult human as well as the pediatricians, a specialty like pediatrics would not have been needed. Even if pediatrician would have taken care of all the children, subspecialties like neonatology or neonatal cardiology or neonatal pulmonology would not have been needed. This tells that, whenever information becomes very large and very voluminous, we need assistance. And this is actually very, very practical. So that, once we need assistance, once we accept this phenomenon that, we will require assistance for the day-to-day problems, we can do better with this. Giving one more example is, let's say when we find a person with fever, the fever could have come from so many conditions. It could have been due to infection, could have been due to environment, could have been due to toxins, could have been due to so many things. But we are summarizing it. What is the most common thing? This is a dengue season, so it could be dengue. This is a flu season, this could be flu. Why we go for most common things, most common symptoms, most common diagnosis? Because we have accepted this that, we might not be able to know the pinpoint the diagnosis with a precision. So whenever we don't know everything about the microstates of a system, we go for the summary of it. When we do a summary or a approximation, we lose the precision. What is precision medicine? When you know about each and every cell, each and every network, or each and every organ, then I think, this is actually precision medicine. With the kind of tools which are coming up, with either, the sensors or the, let's say, visibility tools, we should be able to do this. A great example is COVID, became as like, world would stop. But, we know that, COVID, which viral particle is actually the causative antigen. That's how, we could invent a rapid diagnostic test based on it, as well as, we could do the vaccine about it. So you can see the journey from malaria to vaccine, where, malaria, maybe the previous people thought this is it is due to, bad air, whereas, this is a parasitic infection. Whereas in today's medicine, it is COVID-19, that we say that part is okay, which particular protein is the positive disease, and then how this is actually doing this. So the era has come actually for precision medicine. So with this pretext, little bit theory about AI. So AI is the most abused word, I would say, in the current context. So you would hear this terms called machine learning, AI, deep learning, generative AI, LLMs. So these are all, related fields. If I tell in a very, very, let's say, simplified manner, machine learning is a system where we train the machine to learn so that, it can serve us, as simple as that. So we write some program so that, the machine can actually tell us that, whether there is malaria there or not there. It can predict a disease. It can identify a protein, and it can suggest us that, whether this is there or not there. When computers actually became much more powerful, much more, let's say, capable, then we went into something which is called deep learning, when we can actually ask the computer that, tell us whether pneumonia is there or pneumonia is not there. When even again computational power increased, then we are seeing the era of LLMs or generative AI, where it can not only tell us that, whether this is the disease or not, why this disease, this is thinking in this way, and what can be done about this. So to understand this in our physiological models, or let's say parameters, so early days machine learning, we used to call it a supervised learning. So let's say I have to identify what are the cells identified in a blood parameters. Then I have to train the model or the computer that a neutrophil looks like this, a eosinophil looks like this, a monocyte looks like this, and I train them. So I level the data and I train it. It is very, very manually consuming effort. So that's why large problems could not be solved, but we definitely look for which are the small window problems. And then when I tested through some new samples, then it could classify that what are the different types of cells. Then as the computers actually improved, I told them that, okay, these are the group of cells. You identify what is commonality between them, what is called in oversimplified way, what is clustering. So it could identify based on the morphology or the features, what are the common clusters. And based on my domain knowledge, I could identify, okay, this cluster belongs to this group, this cluster belongs to this group. Even it was cumbersome, and it always subject to, if your training is bad, then your model is bad. If your training is limited, then it is going to work on limited data sets. If your training is not there, then you cannot expect actually accuracy into this. Then the era came of LLMs and generative AI. So, when we said that, okay, hey, model, I'm feeding you all the books which are there, all the journals which are there, all the newspaper articles which are there, everything. I'm just, feeding you everything. You find the clustering. And then, I trained some people to tell that, whether it is answering it properly or not, which is called pre-trained with human input. Then the model or the knowledge what it came up with is actually phenomenal. So now it can identify between emotions, between structures, between let's say, networks, between feelings, between, let's say, physiological models. So now as I am throwing it a picture, just taking it on Android, you can take picture of a X-ray or a, slide, and you are just throwing it to GPT because it has got all these understanding. It is going to throw actually us, whether, what is the classification of this. But now it is just not throwing the classification of it. It is also generating why it classified like this, how the report should be written. And then, do you have some question to ask me? And it can also answer you. So subject to the training data and the method, it is actually used, it can do phenomenal work, what you can see in the previous examples as well as, this example. This just got recently released. So, this is the full-blown picture, how it can actually help. So it can help from taking the history. So a patient now can talk to the chatbot, and the chatbot is going to prompt it to complete the history, so that when the patient is actually coming, the doctor is ready with the, okay, this patient is coming with these symptoms. That's why this could be the differential diagnosis. After the differential diagnosis is done, it can reason that what further questions you should ask to it. It can actually ask a question. It can test its, let's say, radiological pictures or the dermatological pictures or the biomarkers or the lab parameters. It can further reason to fine tune what is the final diagnosis or the, let's say, top two differential diagnosis. Then again, it can, further, prompt it to say that part is okay. I require these things to arrive at a condition which is actually my final diagnosis. After final diagnosis is done, it can also decide that, okay, these are the, best treatment for this demography group. And this is the patient education, what can it do? So this is the advancement, which has happened now. And this is really phenomenal. And these are actually tested on real data sets. And they are actually now getting published. So this paper what I'm showing you just got published yesterday. And Nature published, for digital medicine is actually the authentic source, from this, all these things are getting published. And we are really living in a very, very interesting time. So summarizing, Gen AI and LLMs are subset of deep learning. Just to differentiate what is, let's say, pre-Gen AI era or old, let's say, AI, I can say, where we took the data, we labeled it, we defined a model, then it gave us an output that, whether this is HIE or this is not HIE, this is NEC or this is not NEC, this is eczema or this is not eczema. Whereas in LLM, what you see in the diagram, which is in the below section or the bottom section, we have fed it everything. So it has come out with its own model, which is we call it a generic model. And then it is giving me output. So it can give me output in form of a, educative video, which I can use it for my class. It can give me output for summarizing the report. It can give me output that, why it is thinking this disease it has identified. So it can produce, it can generate actually contextual knowledge along with the classification. This is the main difference between, let's say, ML and let's say generative AI. So why actually this is important? So you understood that, so far this is actually so, it is working really well. But the biggest difference, which I feel, I want to encourage you to take it as a take-home message is, for the supervised learning, machine learning, we depended on people like Mr. Prakash or let's say engineers, who were trained on, models because, it required heavy program knowledge. Whereas in LLM, what has happened now is, you'll be listening this that, Google says or Microsoft says, or most of the codes are now getting, generated as well as written by, let's say, software or let's say by AI. So if you are a doctor, you don't know about programming, there is nothing, no shame about it. Why you should be learning programming? You are already learning a very complex programming, which is physiology biochemistry, right? So if you know some basics of programming, you can actually, get trained on something which is extremely no-code tools where you can write papers, you can do research, you can analyze images, as well as, you can come to the summary of it. So I would say this is the biggest takeaway that, suddenly technology, which is AI, is coming useful as well as explainable. And that's where I think, doctors actually hold a very good, let's say, understanding about it. So, if you have to really use it for research work or medical work, it has to be fine-tuned. We are going to speak about these things in the later classes. how to fine-tune a model. You cannot use GPT for your patient diagnosis because data has to be private, as well as it has to be tuned for your demography, as well as for the particular purpose. We fine-tune a model to increase the specificity as well as to improve the efficiency, because GPT models are very large models, requires heavy computational infrastructure. You cannot actually run, if you have to run locally, you cannot run actually such large infrastructure. So there are actually specific ways. How do you actually, let's say, use these models for healthcare specific purpose? That's where the training is required. Some good examples of, let's say, medical models are, like MedPalm, PubMedVet, and AMI, and lot of things, which are happening. Every day there is a new model which is coming. But important also to understand why training is needed, because it is not trained to generate always the correct answer. It is generating an answer. So the earlier model of GPT, when you wrote actually, okay, give me an article about this, it generated also, bibliography as well as references, because it was trained to generate something. It could not fail generating it. So when it could not find a reference, it also produced a new reference. It was much more dangerous than, like, let's say, not writing an article. So let's say, it can suggest you a wrong decision, a wrong, let's say, treatment. If you're depending on it, you might actually go for a wrong, let's say, treatment effect of it. So that's where efficacy, control, understanding, and it cannot be a black box. So it is very important that, everywhere, wherever you use a Gemini or a Llama or a GPT, it will be written that, it can go wrong. So do check it, 2 times. And then becomes very important for doctors, because, we cannot take that risk that, if GPT is throwing you an answer, not necessarily it is going to be correct, because it can be completely wrong about it. And those papers are not getting published because, that doesn't actually create sensationalism in newspaper. So as doctors also, we need to identify that, I push this to GPT and this didn't work. These are also important things, what has to come out. So this is subject to hallucination. This is subject to bias, as well as, this can get really expensive if you're really running it inside a hospital. So having said this, every day, I think, there is a new model which is coming up. So this is something where it is written in the leaderboard. So, this, competition keeps on happening like IPL. So someday this model is up, someday the other model is up, and this keeps on happening. So selection of a model becomes very, very important. Which model is going to work for what kind of, let's say, use case, that is also very important. And all these things are going to be taught to you, in the due course of time. So, you'd be, also listening to these kind of things that, there is a Llama model which is released with 70 billion parameters. What is actually the time of training? If you ask actually DeepSeek about something beyond 2024, it cannot answer, because it is going to say that, I'm trained up to 2024. So what is free, let's say, a LLM model, which is open source, where the data privacy is not there, what are paid limits, and what are limits, how to preserve privacy. So these are actually very, very important thing, which we will be touching upon as we go actually into the later classes, and how to identify hallucination, how to prevent bias and accuracy, which is very, very important actually in our field of, let's say, specialty. So to conclude, I would say they are no less than engineering. So they are super powerful. They can create videos, they can create content, they can write papers, they can write research papers, they can analyze research, they can do a literature review, they can analyze CT scans to radiology scans to ultrasound. They can discharge summary, they can write it in, split of seconds. They can create patient educational videos. They can create educational videos for students, where I can explain that, how to intubate, how to, let's say, how surfactant works in videos, which is so, so useful. So it has got humongous amount of, potential to, make doctors focus on the real thing, and it is going to act as a great assistant. But also, if it is not controlled, I think, we are going to face the similar challenges. So we are a group of medical AI specialists in the world who are actually tasked to provide, what are going to be the guardrails for, medical AI development. Because, this can also very wrong, go extremely wrong. So like, our social medias are out of our hands. Initially we said that, what is possible with it, people can connect with each other, they can stay happy. But we know that, we have lost a complete generation who are addicted to internet, who are, depressed, who are, anxious because of social media. So we don't want, medical AI also to go to that part. So it is said like that part is now if there are, group of, 10 Nobel laureates who built the Manhattan Project and then we had a nuclear bomb, then imagine that, now you have, 1 million, people of the geniuses of like, the Nobel laureates. And if they're not controlled, what they can build. So that danger always stays. That's where, there are a lot of guardrails, a lot of regulations which are coming in. And as doctors, we should be really, really, watchful for something like this. Uh, Important is it is a phenomenon. It is inevitable. We cannot stop this. Like we could not stop electricity or motors. Same way, I think, or computers. Same way, I think, AI is going to be way of life, is the way of life, and there is no second, talking about it. It is important for us to, as we use Google, right? All of us has an illusion that we understand how Google works. No, we are using Google just as a consumer. We are not using Google as an expert. Same way, I think, it is very important for doctors to understand that, there are a lot more layers into understanding AI. AI has to be explainable based on our physiology so that, this can be used for our patients only and only if this is accurate and, this is specific. So this is very, very important. And definitely healthcare, stands like medical students, doctors, practitioners, a great deal of advantage because, this opportunity is there. So I would encourage that, definitely learn the fundamentals of LLM just beyond, using GPTs or Gemini. Very important to use, which model is required for what kind of our work. And then, at various stages of academics and patient care and research. So this request I have got it from so many people in so many forums and so many conferences, and I'm happy to announce that so we are actually starting a very deep level course which is done by medical scientists, which is done by doctors with PhDs, who are actually understanding the medical part, so that this is becoming actually easier actually for doctors. So this will be certified by IHMR. There will be online courses as well as there will be workshops. So again, many thanks to Dr. Samir and Dr. Ajay, the entire CMIC team, IAP group, for kickstarting this important one. And I can be very sure that this would have started with IAP as first. I think this is going to go to the other specialties like radiology or dermatology or gynecology and obstetrics and other things. So you have taken a lead. This is a very good thing. And I think, you should definitely, be congratulated for this. So with this, I can, conclude my talk. I think, we were slated for 10:30. So I was, little bit conscious that, we don't overserve the time for our initial stuff. We can take questions if they are there.
Thank you, Dr. Satish, for a very nice elaborative session about how we are going to learn in the next 1 month of the May. And this is a really one of the what we can say trailer of the our whole workshop. And we had covered all the topics for what we are going to cover during our session. So it's definitely a very useful session for all the participants who are on the YouTube and on the Zoom, both the platform. So many participants are there and they are really watching you and us as something like that, how we can innovatively give the more AI tool to them. So that will be really get the proper understanding of the AI. Let's discuss few top questions if there. Otherwise, we will definitely continue our discussion in our WhatsApp group related that thing. Very important thing is it's a really good kickstart and followed by the tomorrow's excellent learning session that will be started sharp at 9 o'clock and it will be continue for the 10:30 to 1.5 hours. Tomorrow we will going for a exclusively learning session rather than the any inauguration or the introduction now. One question from the Dr. Neelam Mohan is came from in the chat box. That is the how we can create a patient's learning, sorry, parents learning for the kids disease. So that's something how we can do. So I think we can
Yeah.
having a
So you had mentioned about that Sick Kids a flyer. So do you need an app to go do that, or was that done? I mean, how do
Yes.
you create infographics?
So this can be done by AI. So what we are
No, so
using
what
in
I
S.
want to ask is, in the sense when I talk about AI, that like, is it an app? Is it chat? Is it Gemini, where do I put that to get the, get it out?
So this is a good question. So let's say, it is going to always require an interface. So the model is going to work in the back end, whereas the front end, which is always going to be an app. So what I showed you for SKITs, which is skits.health. So we create something called as SKITs GPT. So after a diagnosis is done, the parents can ask to the GPT through the app that, summarize this, diagnosis for me. Then the different parents are going to have different questions about the diagnosis. It is going to further answer them in a very, very, accurate as well as their medical way. So it is always going to require an app to have an interface behind which the answering engine is going to be AI. So the selection of the AI model is going to be important,
No,
but
I
that's
didn't mean
how,
that.
it is
I
going to
just
be.
wanted
Yeah.
to know how to create a flyer. That's what I meant.
How
Do I
yeah,
create
so
a flyer? Do I need to
we
create it just by giving orders, or how do I create a flyer?
simple, as you said, you just have to say, okay, I want a flyer with this content, and it is going to give you a flyer. You can have a flyer just as an image, you can have a flyer as a video, and that is actually very possible with the current, let's say,
Can I add,
things.
Satish, Dr. Satish?
Yes.
Madam, there are some tools called Napkin AI and Canva. You can create lots of infographics and health education tools, madam. I used Napkin AI is the very one which will give very good infographics.
Napkin, NAPKIN.
Napkin AI,
So we will,
NAP. All those
just
things
for
will be covered.
So we
Spell
will be
it?
covering, NAPKIN, Napkin
Okay.
AI. You can also use Quen now. Quen 3 is actually excellent, which got recently released. You can download the Quen app and just ask that, create this image for me or create this video for me. It is going to just do it within seconds. So
even Canva is very good. It has got a
yes,
very
Canva
good,
is also
very good. It's
Spell that.
awesome. CAN.
CANVA.
Canva.
Yeah. And ma'am, in coming sessions, we are going to talk more about the tools and technologies.
Yeah, that's lovely.
Yeah.
And that was beautiful. Your introduction was very brilliant. I mean, for the years you've spent, lovely. So
No,
lovely
thank
to
you.
be amongst you all. And I'm looking forward to learning and hope I don't get stuck, because the next 2 weeks are a lot of international travelings for everybody who are in this thing for conferences and all. So I'm like looking forward, how will I cope up with that time? But I absolutely am keen to know more and learn from you all.
Madam,
Wonderful.
we had kept enough break during that period. Don't worry.
Okay. Thank you, Samir, and thank you, Ajoy. Brilliant.
Right. So, how the application will work and which application should be required, we will definitely discuss in the upcoming session. And that is our main objective, that how we can handle you to utilize which tool, because the anything can be, if even simple chat GPT also having the such type of the capability that he can also generate the infographics and the flyer, but it should be require proper prompting and proper training and the proper module, that what we really require. And for that purpose only our experts are preparing their presentation. So you can having a some experienced expert tool that you can utilize yourself with a trainable hand, that they can handle you, which should be used, because there is a multiple tools are available in market having considered as a AI tools. So a few tools that would be very useful, and I will definitely sure many of you are utilizing in regular basis that tool. So we will happy to get your inputs also regarding the another tool what we are going to give you as a learning tools to you. You can definitely add on to that over and above what we are going to teach you. So it will give us internal learning process, and that will help the our AI model to improvise.
So just to summarize, you will be getting the generic tools of what you use as GPT or Gemini or Llama or let's say DeepSeek. So these are generic tools. They are not meant for medical tools, but again, there are fine-tuned medical tools, right? So we'll be telling you actually in the coming classes, and along with me, you'll be doing in the next classes. You'll be creating your web page. You'll be creating an app by yourself. You'll be actually summarizing a patient record, as well as, you'll be identifying a medical image. So you'll be doing it hands-on, and we will try to keep it that, you are able to select which tool to use for which use case, so that, you are getting accuracy as well as, efficiency.
So any more questions? We will definitely continue in our discussion on the WhatsApp group. We are again meet tomorrow at sharp 9 o'clock without any delay, and I will try that the most of the you people can able to join with a Zoom with an easy thing. I will share this link exclusively to the all the delegate who has registered for that with a paid version. So I will share that by the email. We will try to put into our group also. Recording of today's session is available on the YouTube. That link is already shared with the you all in the group, so you can also go through the again what the things is about the AI today learned by the doctor, given the details by the Dr. Satish Prasad. Tomorrow, in the 3rd May, we are going to learn building the fundamental knowledge of the artificial intelligence and machine learning and its relevance to the medicine with a subtopic of the introduction of the generative AI and chat GPT and AI tools for the productivity and content creation by Mr. Parikshit Khanna, a very well-known person in the field of the AI regarding his excellent knowledge. So we will again meet at sharp 9 o'clock tomorrow, and link will be shared by you by the email and in the WhatsApp at the end. Thank you. Any more questions? We will definitely take into the WhatsApp. Oh, Dr. Ajoy sir, can we conclude today? Okay. So thanks a lot, and we can concluding the today's session with the thanks not.
Thank you, Samir sir. Thank you. Good night.
Good night.
Thank you, everyone.
Initiative.
Good night.